My name is Andrew Spiegel, and I'm one of the founding board members of the Global Colon Kit of the wrong organization of the World Patients Alliance, and I'm currently the board chair. And it's my pleasure to welcome all of you um, to this valuable webinar. This is on patient safety books for children, another in our series of multiple books. Good to see everybody saying hello in the chats. We love to see where everybody's from. So if you want to say hello and name your organization in the chat, that would be great. So also, next slide in the chat, we are going to put a link. Next slide. For those who require a different language beyond English, we have Wordly. And if you look in the chat, there's a link there, and you simply click on that, sign up, pick the language that you want to see and hear things in. And Wordly will use AI-powered chat and audio interpretation in more than 50 languages. So just hit that link in the chat if you'd like to uh, participate in this webinar in a language other than English. The next slide, please. So who are we? We are the largest umbrella organization working across all diseases on Earth. We provide platforms for our members. We have, uh, I'll show you in a second, nearly 700 patient organization members, and we provide them with a platform to raise the patient voice for the provision and access to safe and quality and affordable medicines. And one of the programs that we put forward are these webinar series, which are happening about monthly these days. The next slide. We currently have, 696 organizations, four more, and we'll hit the magic number of 700 from 136 countries. And you can see from the bottom there, we're very geographically diverse, uh, and we are only 5 years old. So with that, we'll go to the next slide and kick things off. I'm going to turn things over to the world famous Helen Haskell. Helen, kick it off, please. Thank you, everybody.
Hi, I'm Helen Haskell. I am Chair of Patient Safety and Quality at World Patients Alliance. And this is my bio, which I think we don't need to go into. Next slide, please. We have a full agenda today. Andrew has just kicked us off. You've just met him. I'm just going to give you a brief introduction to the patient safety books, and then we will have presentations from Laís Junqueira and Rida Viljoen. I hope I got that right, Rita. I've been practicing, and a panel discussion. Next slide, please. So I just want to have a very brief introduction to these patient safety books because you'll hear a lot more about them from Laís and Rita. Next slide, please. Um, just want to talk about how this began. So this really is something that we've thought about for years that we should have books and courses for children, for elementary school age children, because patient safety is really something that we patient safety advocates feel strongly should be sort of in the DNA of everybody. People should know the basics of patient safety from the time they're small children. Um, and in 2019, Hussein and Regina Kamoga, who's another board member of the World Patients Alliance, and I were giving presentations in Jeddah at the I believe it was a ministerial patient safety ministerial summit, and our co-presenter in this session was a young woman named Laís who gave a very interesting presentation from Elsevier. And we started talking. She was quite taken with Regina's work in the schools um, with small children. And from that, we sort of evolved the idea of these books. We had a big project originally involving teachers from all over the world, and that was sidelined during COVID because This had all happened in late 2019. So we had a few years sort of hiatus where we were just treading water with this, and then we came back with it and with books just directly to students and that teachers can use. And we've got now 5 books for children ranging in age from about 6 to 12 at different levels of books. So the simplest one is I Won't Wash My Hands Today, a hand washing book about explaining to small children why it's important to wash your hands. And then going on up through more complicated topics like, should you be afraid of the doctor and should you take medicine without asking anyone, up to, explaining antibiotics and when you need injections. So that's really all I'm going to say right now because you'll hear a lot more about these from our speakers. Let me have the next slide, please. We have a little video about the patient safety books, which if you could play it now, Harris.
Hi, my name is Dr. Safety. I live in this book, and I've got something important to tell you. Patient safety matters, especially for children. That's why we created this and more stories to help kids understand how to stay safe and feel more comfortable in everyday healthcare situations. We know that visiting the doctor, getting an injection, or even remembering to wash your hands can sometimes feel a bit scary or confusing. But don't worry, we're here to help. There's a whole series of us, 5 fun and friendly books, available in reading, audio, and video, and they're available in English and many other languages. We're sharing these stories to celebrate World Patient Safety Day and to help families everywhere learn how to make healthcare safer together. Want to read more? Just visit the link to discover the full collection. Happy reading! See you in the next story. Hi,
Okay. And with that, I will introduce Laís. Again, her bio is here. She's the Quality Patient Safety and Innovation Manager at Elsevier, the big publisher, where she advises organizations on using evidence-based information and technology to enhance patient safety and clinical outcomes. But for us, she's been a lot more than that, as though that weren't enough. She really has been the heart and soul of this project. She's organized us, she's found the funding, she has kept us on track through the dark days of COVID, and found people for our team and found different ways of presenting the books, different ways of distributing them. She's really just been a genius in all of this. So I am honored and proud to introduce Laís Junqueira, who will tell us her story of how these books came about and what the philosophy is behind them and tell us what is in the books. Laís?
Thank you so much, Helen, for
Next
your
slide,
kind
please.
words. Thank you so much for your kind words. It's the first time that I hear from someone else the story of how this all came together. And I must tell you, it got me emotional. Just, going back to 2019 and just it was a trip down memory lane and a very good one. So thank you so much. And never in my wildest dreams I thought Helen Haskell would be introducing me and with such kind words. So yes, this is a very good day for me. So let's talk a bit about the Dr. Safety book series and a bit about how we created the content of the books and why we got together in such efforts. So if we can go to the next slide, please. There's a bit about myself there, the work that I do. And if you click again, Hadis, we'll be able to see that this is little me. This is me when I was 5 years old, when I had my first misdiagnosis. And I was lucky enough to be, to have my mother, next to me. And my mother is also a doctor. She worked in quality and patient safety most of her career, at least the career that I could understand from a young age. And it was really amazing.
Laís, we can't hear you.
Practices with watching her work. And if we go to the next slide, most people don't have that same opportunity. If we think together on how we came to the topic of patient safety, most people will have stories about their family, their friends, themselves, their loved ones, an event that happened, or something that had to do with their safety or the safety of their loved ones. And that's the initial understanding that they had about safety, right? What if we could change that? What if we could make children learn about patient safety, the basics of patient safety, and turn that into a habit, just like the habit that we have of brushing our teeth? So our idea was to incorporate patient safety as a habit for the future generations. And if we go to the next slide, you will see that the lessons that children learn in school can really have an impact and create habits of a lifetime. We have examples published about the recycling movement, about nutrition programs, about financial education. I actually learned how to recycle with my son, and he learned that at school. So really teaching children young can really support the future that we want with more safety. So if we move to the next slide, you will see that our objective was to empower the community to act for safer care through the education of children by developing this children book series that supports the education of children about patient safety. And one thing to keep in mind is the trickle-down effect of educating children. When you educate a child, they go home and they educate everyone around them. They educate their friends, their family members. So it's very important to also acknowledge that. It's the movement, the wave that we create. So on the next slide, you will see that one of the very strong characteristics that we had for this project was to make sure that we were creating stories that would embrace representation. So you will see through the characters, the illustrations, their day-to-day lives, that they are located all over the world. We have representation from the Americas, Africa, Middle East, Europe, and Asia. And we were very careful to make sure that children would recognize themselves or those around them on the books as well. So you will see there are different illustrations with different types of characters as well, and their costumes and habits will change from book to book. On the next slide, we'll be able to see Dr. Safety. Dr. Safety is our superhero, and her superpower is to share knowledge. She shares knowledge with children about patient safety. This was a discussion that we had at the beginning of the project. What would be her superpower? What does she do? And really, we came to the understanding that the best gift she could give to those children was knowledge. So that's what she does. And on the next slide, you will see the story arc and how we go about the day-to-day life of the characters. So taking as an example, book 1, which is the hand hygiene book. Lucas was having a normal day, right? He woke up and he was ready to win the day. And then he made a decision that day, which was he was not going to wash his hands that day. He goes about his day, he plays with the dog, he plays soccer, he goes about his day. And then when he goes home to have lunch, he's there with all the germs, with all the dirtiness in his hands, And Dr. Safety appears, and she teaches him that he should wash his hands. And not only that he should wash his hands, why, but also how he should wash his hands. So there's a transformation of Lucas through knowledge. They wash their hands together, and Lucas becomes a member of the Safety League. This is a very important aspect of the books. The beginning of the story, it always starts with a child. And at the end, that child, after learning from Dr. Safety a safety practice, they become a member of a league. So now they're part of the group, and they are also able to teach other people about the knowledge that they just got. So that's the story arc that we have. On the next slide, you will see the 5 books that we have available. The hand washing book, the I don't want to see the doctor, should I take this medicine, do I need an antibiotic, and when do I need an injection? And I want to make sure that we highlight on the next slide the people that were behind this project. Without those people, nothing would have happened. And there were years of discussions. And I must say that it was always with a generous heart that they would share their feedback, and we would build upon the content that we had. So I am extremely grateful for everyone, Helen, Haskell, Hussein Jaffrey, Regina Camoga, Cristiane Tavares, Thiago Dalcin, and Pedro de Luna. They were a fantastic team. And, if the world was about to come apart and I had to pick a team, I have my team ready to face the apocalypse. And if we go to the next slide, we will see 3 more people that were fundamental for this from the Elsevier Foundation: Ilan Schiem, Domisiana Francescon, and Maharanam. They were really supportive since day one that we asked for the Elsevier Foundation support to fund the illustrations, the first printing of the books. They did not blink, and they jumped to help. So I really appreciate that. Now, on the next slide, I just want to make sure we're going to share QR codes. We're going to share links for you to download the books. But if anything happens and you lose the QR code or you don't know where to find us, it's very easy. You can just go on Google, and you can play the video now, Haris. If you go on Google and you type Dr. Safety Books Children, you can find us. So you don't need to remember the website links. You don't need to remember the QR codes. All you need to remember is Dr. Safety Children Books. And you'll be able to find not only the website, but also find the Instagram page that I'll invite everyone to join as well. So Haris, you can play that video for us, just so you can see how easy it is to find us. So Dr. Safety Children Books. And then if you scroll down, you'll be able to see the links. There's the Elsevier Foundation link, the videos that we have as well on YouTube, the World Patients Alliance link, and you can just click there, and it's super easy to find the books. There's a bit of information about how you can get involved. These are just ideas. If you want to translate into another language or print and distribute, we also have there the guides on how you can do that. And if you want to access the book, all you have to do is to click on the link and you'll be able to read it. And with that, I'll leave you with a QR code on the next slide. There's a QR code, and I would also like to invite everyone to follow us on Instagram. We have their materials, videos, pages, and please feel free to print the books, to distribute them, and to distribute with the children you know, with the schools that you know, with the hospitals that you know. These books are free for everyone, and anyone can print them and distribute them. And with that, I will hand over back to Helen. Thank you so much, everyone.
Thank you, Laís. That was terrific. And I should add that the books are available in many languages. Right now we have 5 languages on the website, and we have several more in the works. So, and if anybody is interested in translating into another language, please contact us. As Laís said, there are instructions on the website, and we can help facilitate that. It is not as difficult as it sounds. Um, so thank you again, Laís. That was great. Next slide, please. Here we are. So Rida Viljoen is from the South African Cystic Fibrosis Association. She's a life coach and educator. She works with children and adults alike. She's been a great asset to this project. And SACFA has been a huge supporter of this project. They have used their resources to provide the audiobooks that we have online, and which is the basis for the flip books that our first 3 books in English are available in, which are, I think, a great asset for children, for reading to children. And she is going to tell us a little bit about how all that happened and their interpretation of the book. So, Rita, over to you.
Thank you very much, Helen. Thank you, Andrew, for inviting me to join today in this webinar. The next slide, please. So, yeah, next slide, please. So I heard Laís speaking in Cape Town, and I realized that often we think in terms of empowerment or a big word like patient safety. We think in terms of adults. And it just came up again when she reiterated the fact about how important patient safety is. What would happen if we really worked with our little people and we do and take a different approach to patient safety? Next slide, please. So if we look at the research, we see the literacy gap is 1 in 7 people is illiterate in the world. And I thought to myself, what if we rather see that as the opportunity to introduce an audiobook or a video book where a child could hear, read, and experience, feel the patient safety for themselves. And I realized that's when we are going to create little safety leagues, one little person in turn, and that is going to go to the collective house, as Laís has explained. And that's how we're going to create a global safety league. Next slide, please. Creating this global, you can just skip on, Harris. And that's when I got hold of Kevin Abbott and his amazing team that put this all together for us. So with no further ado, on the next slide, we are going to have a little moment of seeing what the video book looks like.
You're listening to I Won't Wash My Hands Today. This is Lucas. He just woke up after a great night of sleep. Good morning, Lucas. Lucas walks to the kitchen, where his mother is preparing breakfast. He is ready to eat when his mom reminds him.
Lucas, please wash your hands before eating.
Lucas is not happy about having to wash his hands. He doesn't understand why this is a rule in his house. And he decides,
I won't wash my hands today.
Lucas eats his breakfast and starts his day. He pets a dog. He goes to the bathroom. He plays soccer with his friends. And it is time to go home for lunch. After all the playing, Lucas is hungry. He sits down at the table to eat, and suddenly, Dr. Safety appears.
Lucas, stop right there.
Who are you?
I'm Dr. Safety, and I was sent here to help you be safe. There are bad germs that are waiting for a chance to get into your body.
But I can't see anything. Where? Where are the germs?
Oh yes, I forgot. You can't see the germs. Let me get my super powerful special magnifying lens to show you the germs.
Lucas looked through the magnifying lens at his hand and sees all kinds of germs on his skin.
Oh no! How did they get here?
Germs live everywhere, Lucas, and they climb on our hands during the day.
Oh no! Then I can't play outside anymore.
No, Lucas. All you have to do is wash your hands with soap when you are done. Let me show you. Let's start by wetting our hands. Then put a little bit of soap on them. Scrub, scrub, scrub for 20 seconds. Sing with me. Happy hand scrubbing to me. Happy hand scrubbing to me. Happy hand scrubbing to me. And to Dr. Safety. Now we rinse off the soap and dry our hands on a clean towel. Or we can let the air dry them too. Just make sure you don't blow on them. Let's look at your hands now, Lucas.
Thank you, Dr. Safety. I didn't know washing hands was so important.
Yes, Lucas. Washing hands is very important and keeps you safe from germs. You're incredible. Here is a badge to celebrate. Welcome to the Safety League. Stay safe. And all of you listening can help others keep safe too by teaching them how to wash their hands.
That's right. You can help keep yourself and your loved ones healthy by washing your hands often, especially during these key times when you are likely to get and spread germs. Before and after eating. Before, during, and after preparing food. Before and after treating a cut or wound. After using the toilet. After blowing your nose, coughing or sneezing. After touching an animal, animal feed, or animal waste. After touching garbage. And whenever your hands are dirty. Be like Lucas and teach someone how to wash their hands today. Let's do it. You've been listening to I Won't Wash My Hands Today by the Elsevier Foundation and the World Patients Alliance, with the voice talents of Kevin Abbott, Tara McPherson, and David Wilkie. And a big thank you to the South African Cystic Fibrosis Association for making it possible.
Rida, we can't hear you. Rida, we cannot hear you.
Sorry. Yes, sorry guys. And that is how we are going to teach patient safety to little people today to raise safer adults tomorrow. Thank you very much, everybody.
Thank you, Rita. Next slide, please, Harris. So now we're going to have a panel discussion with our speakers, and also we will be joined by two of the translators of our books. One is Dr. J.S. Aurora from the National Thalassemia Welfare Society in India, who's on the World Patients Alliance Advisory Board. and Inga Damanti from the Center of Excellence, Patients and Safety Quality at Erlangga University in Indonesia, also a member of the WPA Advisory Board. And then we will have Laís and Rida. So welcome, everybody. I would like to sort of kick it off by asking you individual questions. First of all, to our translators, Inga, I'll start with you. Why did you want to translate these books?
Helen, can you hear me, Helen?
Oh, I can. And yeah.
I'm really sorry. Okay, so actually, what is my main reason to translate the book? Because I see this book is really good initiative, actually. And then I see this book as a valuable tools for these children to learn from the very early age. So that's why when we met at I met with Laís in South Africa, and then the offer to help translating the book. We're really happy to. So far, we have been translating 3 of the book, and then we'll continue to do more. So because this is a great initiative, and also we really inspired with this one, and we see that the topic is really unique, and also the character that is chosen in the book is like a mix. There's a Chinese, and then someone Lucas Tobias and the Chinese girl, something like that. So that's from my perspective. Thank you, Helen.
Thank you, Inga. And Inga has got a touch of laryngitis, so I appreciate her joining us and trying to speak on this panel. So, Dr. Aurora, I will come to you next. Why do you think it's so important to educate children with books like these?
See, as far as translating these books is concerned, India is a vast country with over 1.45 billion people, and Hindi is spoken by most of them. If you see worldwide, at least after English and Mandarin Chinese is the 3rd most spoken language, even more than people speaking Spanish or French. And this is the topic of, I can say, most concerned, more relevant. Reason being, see, this is the daily encountered by the people, like hand hygiene, antibiotic misuse or antimicrobial resistance, or you can say this denial of getting treatment. That is very common in families. So when a child go ask the parents or the elders to go for the treatment, if the elders say, sometimes elders say, no, wait, it's okay, fine, we don't want treatment. Then even the child can say, yes, you should go since you are having pain, abdomen or fever, whatever it is. So you should go treatment. So I think this was very important. So that was the reason I chose to translate it. And moreover, the characters were involving the children. So that directly links children with the problem. So I think that was the best way to communicate health, hand hygiene and other health issues with the kids.
That's great. Thank you. And I omitted to say, if you have questions, please just put them in the chat, and I will relay them to to our panelists. So please ask them anything you want. I'm going to go now to Rida. Rida, why do you think that your approach is better than just handing out a book to children? You have a comprehensive approach, and I'd like to hear more about it.
Helen, I feel that parents often battle to find time to sit with the children and to read a book. And as I said, we know from research that 1 in every 7 adults are illiterate. And I just really felt it's so important that we do have a method of delivering the message directly with children. And then having this beautiful music coming through, the voices, the characters, the whole ensemble of it being together and bringing life to the book. so that a child can see how exciting it is to be empowered and to feel that difference that they could make, not only for their own lives, but also for the sibling or the mommy and the daddy in the household. And as Laís said very correctly, little patient safety leagues running around, educating their world around them is so powerful. And it's so important to really support our children and to teach them and raise their own voices. I love that perspective that we could do that for our little safety leagues.
That's great. Thank you. Thank you, Rita. And Laís, can you tell me what other possibilities do you see for these books? What other uses can they be put to, and what other, possible formats and presentations could we have?
Thank you so much, Helen. I think about getting involved with the books and what you can do with the books and what we expect to have from the books. I think, first of all, we have the ebooks ready. We have audiobooks. We have videos, the flip books that Rita just shared. But we need to make sure that those materials get to the children, right? That is what we need to do right now. So I will invite everyone to share those links with children, with the parents, actually, of the children. If you see a child engaging in a video, why not offer to show them doctor safety books? We also had examples of community activities in Brazil of someone that volunteered, Fatima, that's her name, she volunteered to read the books, first for children in her building where she lives, and then she gathered a group of children and she was presenting the books and reading to them, and they loved it. And then she moved on to do that book reading to a school. So she went to a school, she had a contact there, she asked if she could do that, and they said, sure, why not? So she went there and she read the book for a class. And another example that I'll share with you, completely different, Nidvar Trust, an NGO, fantastic work that they do in Uganda. So what they're doing there is they are reading the books for the children in a community. So they printed one copy and they are reading the books. Now what they are doing is they're going to print more copies of the books to distribute at a local school and also for the children that were part of the first reading. So those are two examples. You can organize reading sessions. If you have a WhatsApp group, a Telegram group, or whatever communication channel that you use, please feel free to share those books with your friends, with your colleagues, with people you work with. So you can really do that. I see there are many questions on the chat about the languages that we have available. So right now we have multiple languages available. We have English, we have Portuguese, Indonesian, Spanish, Khmer. Someone asked about Arabic. We are in the process of translating into Arabic. So very soon we will have those books available. And if you speak any language that is not available here, please reach out to us. The more languages we have available, the more children we can reach. So on the website, and I pasted here on the chat as well, there is a guide available on how to translate and who to send messages to. Please reach out to us before you start translating. Just in case someone else is already doing a translation, we can share the work, and then you can do one book, the other person can do another book. But please, we don't want you to do rework. So contact us, get in touch with us, and we'll do that. And if you can print books and distribute them, that would be fantastic.
That's terrific. So now I want to sort of throw it open. What other topics do you think we might want to cover in future books? Does anybody have any thoughts on that?
Just Helen, what you asked to Leah's the earlier question, what other options are available for spreading the message? I think the best message, if at all, they can make some concise for Instagram, because it's a very common and reels are there. And if they can be adjusted in that much time, that will be very fast moving and spreading all over the world very fast. I think that should be the one message I think. And I like to share one example in my life that in India, in Delhi, at one time of time in 2010, there's a lot of pollution in this winter season. And we have a big festival that's called Diwali, just like Christmas in your European or other countries. So a lot of these crackers are being burnt. So our chief minister, she created it, involved us, small kids and students, and said that say no to crackers. The effect was so much that the children who were very fond of burning crackers and all these things, and they brought down to more than 70-80%. It was hardly 20-30% crackers were. Even they were saying no to their parents, that we don't need crackers for this Diwali function. So same way, there's these books with the involving the children that will be a very helpful in creating awareness and involving patients or parents, their parents or family members for creating awareness.
Great. Thank you. Thank you. Anybody else? What are uses that you could put this to in your country and best means of dissemination?
Helen, hello, Helen.
Thank you.
Can you hear me, Helen?
Yes, I can hear you.
Yes, yes.
Yes, and thank you. Thank you so much for speaking up with your laryngitis.
Yeah, sorry. Actually, my question is it possible for us to get the book printed and then put some in the, for example, in the school library? Because we have the storytelling program where we printed the storybook and then we read the book for the student, but then we also give some of the set of the book to the school library. So is it allowed for this one, or we can only use the online version? Thanks.
Very loud. Sorry, Helen, for jumping in.
No, go ahead, Laís.
It's very allowed and encouraged. So if you want to print books and give them to people, go for it. The only thing I'll ask you is to take a photo and post it on Instagram, tag us, so we can make sure that other people learn about this as well, and we can encourage them to do the same. But yes, please.
Yeah, that's terrific. You can really use them any way you want. And we have a question in the chat. Are there grants available for printing these books? And the answer is no at the moment. But Laís, I don't know, and even Hussein, if you could weigh in on this, what the possibilities might be for the future.
Yeah, I think at the moment we do not have any funds available, but myself, Laís, and I think the team, including yourself, we are really contemplating on this, how can we really make them available everywhere in the world. So we are still working on that. And let's see, hopefully, we might find some funding for that purpose. And as Laís mentioned in her presentation, we really wanted to take it to the schools, right where the children are. And the problem again was, how many books can you print, for one country, even for one school, you need hundreds and hundreds of books just for one school. So I think this is something that we are really, working on, and hopefully we'll come up with some solutions. So just bear with us.
Thank you, Hussein. And I see another couple of questions in the Q&A. Frankie Fomberg has asked, what do you, in some resource constrained settings where access to clean water is limited, how can we encourage hand washing? Some may see it as wasting water. are there alternative ways for hand hygiene that we could suggest? So certainly are alternative ways that we could suggest, but they're not in the book. So I would like to sort of turn that over to our panel and to Laís, and maybe Regina also could weigh in on this, about, what the possibilities might be for spreading the word about waterless hand cleaning.
If Regina's here, I would like to hear her thoughts on that.
Regina is not in the speakers panel, so she cannot speak.
Oh, okay.
All right. So
well,
some
go
of the
ahead.
some of the alternative methods that we have, we did not cover them on the books, but if you go on the WHO website, which is the guidance that we use on the last page of the book, we use the hand hygiene guidance from the WHO. So they do recommend alcohol-based hand rubs, but according to context, of course. But yeah, the book really focuses on hand washing for children. That's the focus of the book.
Yeah, and one of the things that Regina has done in Uganda is they created tippy tap, sort of little hand washing stations, where they have water coming out of a bottle that they have set up. So that's more, conserves water better. It's not like having running water in your house. So that is another possibility. I'm just looking to see, are there more questions in the chat, Ramis?
One thing that I see are many comments on the chat of people saying that they will share this with their local hospitals, that they will share this with schools and with other institutions, the pediatric nurses in the project. Please, if you can let us know about the initiatives that you're doing, that would be great, because the more, every time we present those books, we would love to also share the initiatives that are happening across the globe. It's impossible to track everything, so we do need your hand in telling us the efforts that you're doing with the books, so we can make sure to share with due credits for everyone. Thanks.
That's great. And I also see a question about getting the book in Spanish. If you go to the website, Carlos, follow the QR code or put it into Dr. Google. We have Spanish versions available, and you can download them and print them. So I think, let's see, other topics. I mean, I am curious about that. What other topics, would people like to see covered if we're able to make books in the future, more books in the future?
One topic I would really love to see, Helen, would be vaccines.
That's a good point.
We do have a little bit of that in the injection book, but I would love to have a book dedicated to vaccines.
That's a very good point. And I think there's a lot we can do. Someone's asking about a book in Braille. No, we would love if you're capable of translating it or creating a book in Braille, we'd love to work with you on that.
And Ellen, just one more thing. I think translations into other languages with artificial intelligence, it's really become very easy. So if any one of you are ready, the office can translate them through AI and then send it to you. So you can do the review, and if you see the language is right, then we can use that language as well. So you don't really need to translate line by line. We can do it for you, but you'll have to do the reading and see if it is right language. And if you are happy, then we can develop in those languages as well. So you can contact the office. The email is office@worldpatientsalliance.org. So you can contact us and we can, help you translate in other languages as well.
Yeah, that's terrific. And, you know, are there other ways that you can use these books in your country? Has anybody got any ideas for us? I mean, we had originally thought about training teachers to use the books, you know, having meetings and distributing books and training teachers. But even if we can't distribute books, I think we could train the teachers. Because patient safety is maybe not something that is as intuitive to most people as it is to us. Here's somebody saying,
If I may add to that, Helen, there is a school in Cambodia called Khmer School that are adopting the books as part of their curriculum. So first of all, they taught the teachers about how the books, what the books are about, and now the teachers are using the books as part of the curriculum to teach children how to wash their hands and medication safety and so on. So there is a great example of what you just mentioned happening right now in Cambodia. We're just waiting to receive the photos of that, actually. But yeah, this is very good.
yeah, no, that's great. And I see Elsie Evans has said we should, you know, have some activities for teachers that make it fun. Yeah. Create games for children based on the books. Yes. Someone had mentioned coloring books earlier, which I think is also a nice idea. And see,
Helen,
yes.
yeah, I also I think I would like to say that we know that this year the World Patient Safety Day, the theme is the infant and child healthcare. So I think the idea of even organizing this webinar just before September was the idea that people can use material resources out of this project and use in their own respective activities. So if you are organizing any events, anything, please feel free to use the resources available on our websites, and you can use these flip books, you can use these all of these materials, they are available.
Yes. And you know, with that, Hussein, let's see, I just go through a few more and then I'm going to turn it over to you to close us out. So in India, we have teacher training sessions on medication safety in the books. Yes, a lot of these books revolve around medication safety, which is interesting, but that's one of the biggest problems with children is you know, the difficulties of having safe medication for children because they're so variable in their needs. And yes, having it, you know, connected with environmental hygiene and cleanliness. Yep. Yeah, tying it into that. So there are a lot of good ideas here in the chat. If any of our panelists, do you have anything else that you want to add? Otherwise, I will turn it over to Hussein for our closing remarks. Okay, Hussein, can you take us home?
Thanks, Helen. It's been an absolute pleasure to be part of this team that not only, thought of this idea, but then, really we worked together very hard to bring it together. I'm very happy to see the final outcomes. And I think it's just the beginning of our journey, not the end. I think there are more and more ideas where we can develop more books for children, and we've already started receiving messages from different parts of the world where kids have seen these books and their behavior has changed. So we'll definitely be bringing out those messages and giving it to everybody to see how behaviors can be changed right from the beginning, right from the time where actually if you get those messages, they become part of your personality as you grow up. So, but I would like to, express my sincere appreciation to our distinguished speakers, panelists, and to all the participants who joined us from across the globe. Your engagement and contribution have made this session very and truly impactful. I would also like to sincerely thank our partner, the Elsevier Foundation, for this great collaborative work. I'm also grateful to our team, especially the editorial and the creative team, for their passion and dedication. And today we have witnessed something truly meaningful. The ways simple yet powerful tools like children storybooks and audiobooks can shape the future of patient safety. The Doctor Safety series is more than just stories. It's a movement to instill safe habits and awareness in our younger generation. So now, so we now have the opportunity to embed patient safety in the hearts and minds of children everywhere. So as we conclude, I would like to, invite you to continue this journey with us, share these books with your networks, use them in schools and communities, and also together, let us raise a generation that understands and values safety in healthcare. I would also like to extend our deepest gratitude to Roche for their generous sponsorship for the World Patient Safety Day 2025 campaign, which actually has enabled us to advance this vital mission. So thank you once again for being part of this important initiative, and I look forward to your participation in our main World Patient Safety Day event on 9th of September. Thank you very much.
Thank you, Hussein. Thank you, everybody. Thank you for coming, and thank you for your interest in our books. I will sign off now.
Thank you. Bye-bye.
Bye-bye.